Good afternoon, and thank you for having me. I'm very honored to be here. We promise change, but can we deliver? There are almost 1 million people in need of substance abuse treatment in America's jails and prisons. And I'm here to talk with you today about the role of the criminal justice system in addressing addiction, and particularly the needs of Black Americans who are in the criminal justice system. Addiction is stubborn. Addiction is very difficult to treat. These other chronic illnesses, such as type 1 diabetes, hypertension, and asthma, are also difficult to treat. In fact, when we look at relapse rates across these chronic conditions, people with addiction relapse at very similar rates. And so that is to say, right, people with type 1 diabetes, with hypertension, with asthma need to see a doctor or go to the emergency room for an increase in symptoms, for complications, for not sticking with their programs. In other words, they relapse at similar rates to those with addiction. And so it's in this way that we should not punish relapse, but we should be looking at it as an opportunity for intervention. We should be looking at it as an opportunity to continue treatment or to restart treatment, but not as an opportunity for punishment. So, did you know that the criminal justice system is the single largest referral source to publicly funded substance abuse treatment in the United States? So let's talk about some stats related to how people get into the criminal justice system. Black and white Americans sell and use drugs at similar rates. Black Americans are 2.7 times as likely to be arrested and 6.5 times as likely to be incarcerated as whites for drug-related offenses. So we are bringing more Black Americans into the criminal justice system despite similar rates of use, similar rates of sale. They are arrested more often, they go to prison at the state level or the federal level more often than their white counterparts. Yet, only 15% of people who are held in state prison or in jail who need treatment actually get treatment. So that means less than 150,000 of the 1 million people who need treatment actually get professional counseling, residential treatment, detox services, or medical assisted treatment. We are chronically underserving those most in need. When we do get into treatment, what happens? You can see that the overall completion rates are really not that great, right? Less than half of whites complete treatment, and only about 1/3 of Blacks will complete treatment. When we look at different referral sources, you can see that for those who are referred by a source where there's some sort of consequence, some sort of measure of accountability, such as the criminal justice system or employers, that folks do better than healthcare referral or a self-referral to treatment. And in fact, when we look at employer referrals, this is when Black Americans do best in terms of their likelihood to complete treatment. One way to interpret these data, to process this information, is to say that this is an individual level problem. And in fact, that's the most common thing we say, especially in the criminal justice system. It's the individual's fault that they did not make it through treatment. They didn't try hard enough, they're not committed yet, etc. I would pose to you that what this is also saying is that this is a system problem. This is calling attention to the professionals who deliver supervision and treatment in this intersection with the criminal justice system. It is calling attention to the lack of funding. It is calling attention to the content of treatment. People who are in jails and prisons, if lucky enough to receive treatment, usually receive less than 4 hours a week of substance abuse treatment. But we know that those in prisons and jails are 10 to 12 times as likely to have severe substance use disorders. We know we are chronically underserving or ineffectively serving those in the justice system. We know they come to us with greater problems than the general population. So what matters to Black clients if we're going to try to make a change? And this is the call to action that I give to you today, right? What we do matters. Quality matters. We know that we need effective behavioral interventions for people with substance use, but these ancillary services will increase the chances for positive outcomes. We know that when employers refer to treatment, Black clients do better. When programs have education programs within them, Black clients do better. When programs have health care attached to them, Black clients do better. When they have family services, including child care, Black clients do better. When they provide transportation, Black clients do better. And so on, with housing, with addressing trauma and violence. What we do matters, and we need to be more vigilant in the kind of services that we provide so that people can fulfill their potential, that we help strengthen their determination, their spirit, their intellect. We promise change. We can deliver. We have to. Lives depend on it. Thank you.